Cardiac rehabilitation is a monitored exercise program that's reserved for specific cardiac patients with certain disorders. It typically is run by a nurse and an exercise physiologist, although we also have dietitians available and other resources for our patients. Okay, so patients generally are here 3 days a week for 12 weeks. And they, of course, do exercise, but there's also educational supplements. There's also cardiac risk factor modification. There's education about smoking cessation and other heart important education. Cardiac rehabilitation is indicated for all patients that have had coronary artery bypass surgery, a recent myocardial infarction, coronary stents, as well as valvular surgery or congestive heart failure. So cardiac rehab is very important for patients, not only to give them the confidence after a major cardiac event, but multiple studies have confirmed that you get lower rates of hospitalization for cardiovascular issues, as well as lower mortality with a completion of a phase 2 cardiac rehab program. The most rewarding thing I've seen with cardiac rehabilitation is that every patient I've sent has come back to me after they completed the program and said how grateful they were that I sent them to it and how much they got out of that. And there's very few things in cardiology that we get that kind of response to.